lecture is an introduction to heart failure. In this lecture, I will be explaining the different types of heart failure and why is it important to understand the type of heart failure. So to start off, the figure drawn here shows how the blood flows through the heart. The right atrium receives deoxygenated blood from the various body organs and tissues through the superior vena cava and inferior vena cava. From the right atrium, the blood enters into the right ventricle and the right ventricle expels the blood into the pulmonary artery. The pulmonary artery sends deoxygenated blood to the lungs for gas exchange. The deoxygenated blood gets oxygenated in the lungs and the oxygenated blood is carried by the pulmonary veins and it returns to the left atrium, and from the left atrium it enters into the left ventricle, which pushes the blood into the aorta, and the aorta then distributes the blood to various body organs. So this is how the circulatory system of the heart works. So what is heart failure? Heart failure is complex clinical syndrome that results from cardiac impairment in ventricular filling or ejection of blood. So clinical syndrome means symptoms and physical findings that indicates a specific disease. A direct cause may not necessarily be known. So the signs and symptoms indicates heart failure, and this results from structural damage to the heart or failure of the pumping action of the heart. So there is a defect in ventricular filling or ejection of blood. In high output heart failure, the heart is healthy and normal, but the metabolic demands of the body is very high in situations such as hyperthyroidism, anemia or pregnancy. And to meet the metabolic requirements, the heart muscle has to pump harder. It pumps with a more forceful contraction. The contractibility increases, the stroke volume, cardiac output, ejection fraction increases, and this increases the workload on the heart. And the workload on the heart increases, the strain on the heart increases, and eventually over a period of time there is exhaustion of the heart. So because of increased workload and exhaustion, the heart fails to supply adequate blood to the various parts of the body, and this can cause tissue hypoperfusion and organ failure. So in high output heart failure, the stroke volume, cardiac output is very high, and this is due to an underlying medical condition. So the underlying medical condition needs to be identified and treated in high output heart failure. So speaking of low output heart failure, unlike high output heart failure, in low output heart failure, the metabolic demands of the body is normal. So the metabolic demands being normal, there is weakening of the cardiac muscle. So the heart muscle weakens, there is weakening of the cardiac muscle, and this decreases the stroke volume, cardiac output and ejection fraction. And this results in low output and hence the term low output heart failure. So the low output heart failure is due to ventricular dysfunction. If the right ventricle is involved, it is known as right ventricular dysfunction. And if the left ventricle is involved, it is known as left ventricular dysfunction. If both the ventricles are affected, then it is known as biventricular heart failure. So the second type of heart failure is left-sided versus right-sided heart failure. Since the left ventricle is the major pumping chamber of the heart, the left ventricular dysfunction is the most common form of low output heart failure and is the major target of pharmacologic intervention. Now, the right ventricular heart failure may coexist with left ventricular heart failure if damage is sustained by both sides of the heart, or it may occur as a result of complication of progressive left ventricular failure. So, left ventricular failure progresses over a period of time to affect the right ventricle, leading to right ventricular failure which coexists with left ventricular failure. So what are the signs and symptoms that are observed in left-sided heart failure and right-sided heart failure? In left-sided heart failure, the left ventricle fails to pump blood into the systemic circulation, and this creates backward pressure into the left atrium. So the pressure in the left atrium causes accumulation of blood in the pulmonary veins and the pressure in the lungs increases. Because of increased pressure in the lungs, there is transudation of fluid into the pulmonary interstitium, and there is accumulation of fluid in the pulmonary interstitium, and this causes symptoms such as shortness of breath, trouble breathing, coughing, or reduced exercise tolerance. So these are the symptoms of left-sided heart failure. So the left-sided heart failure, the symptoms are related to the lungs. In right-sided heart failure, the right ventricle is weak and reduces the ejection of blood into the pulmonary artery. So this creates backward pressure in the right atrium, and the blood builds up in the superior vena cava and inferior vena cava. That is, there is build-up of blood. The blood accumulates in the peripheral veins, and this increases the pressure in the peripheral veins, causing the fluid to move out into the surrounding tissues, and there is build-up of fluid in various organs such as intestine, liver, lower limbs. So this can manifest as bloated abdomen or edema in the legs. So the symptoms of right-sided heart failure are related to the peripheral regions. When both sides of the heart are affected, it is known as biventricular heart failure, and the symptoms are a mix of left-sided heart failure and right-sided heart failure. Coming to the causes of right ventricular dysfunction, the cause can be idiopathic or it can be of unknown etiology. The pulmonary artery hypertension is a common cause of right ventricular dysfunction. There is increased resistance in the pulmonary artery which impedes the blood that is released from the right ventricle, leading to right ventricular dysfunction. Also, right ventricular dysfunction can result from pulmonary process due to the involvement of the lungs. So fibrosis of the lungs, various collagen vascular diseases, and certain drugs can cause damage to the lungs, and this can increase the resistance to the cardiac output, and this can cause right ventricular dysfunction. Also, the cardiac muscle of the right ventricle may be involved in medical conditions such as myocarditis, pericardial disease, valvular diseases, or ischemia or scarring of the right ventricle, and this causes right ventricular dysfunction, decreasing the cardiac output and right ventricular failure. So switching to left ventricular dysfunction. Left ventricular dysfunction is divided into systolic dysfunction and diastolic dysfunction. The third type of heart failure is systolic versus diastolic heart failure. In systolic heart failure, the stroke volume, cardiac output and ejection fraction is reduced, and this is because of reduced contractility of the heart muscle, thus decreasing the ejection fraction. So ejection fraction is reduced in systolic heart failure, whereas in diastolic heart failure there is impaired relaxation of the ventricle. And as we know that during the relaxation phase or during the diastolic phase, there is ventricular filling. So because of increased filling pressure in the ventricular filling is reduced, and since the ventricular filling is decreased, this can lead to diastolic heart failure, the ejection fraction being normal. So this is also known as heart failure with preserved ejection fraction. So the heart failure due to systolic dysfunction is known as heart failure with reduced ejection fraction, and the heart failure due to diastolic failure is known as heart failure with preserved ejection fraction. So a critical marker for differentiating systolic heart failure from diastolic heart failure is left ventricular ejection fraction. So the clinicians are encouraged to measure ejection fraction to differentiate systolic heart failure from diastolic heart failure. So coming to the causes of systolic left ventricular failure, coronary artery disease is the most common cause of heart failure in patients with systolic dysfunction. So coronary ischemia causes scarring of the left ventricle, and this can lead to decreased contractility of the left ventricle, resulting in reduced cardiac output. So the other causes of pump failure is post-streptococcal heart disease, viral infections affecting the heart, or chronic alcoholism causing alcoholic cardiomyopathy, or persistent arrhythmias can lead to heart failure. Systolic heart failure can also be precipitated because of chronic hypertension causing increased resistance in the systemic arteries, causing impedance to the cardiac output that is released by the left ventricle. So, chronic hypertension or valvular heart disease, aortic stenosis increases the resistance to cardiac output, and this can cause systolic heart failure. So coming to the causes of diastolic dysfunction or diastolic heart failure. As we have learned that diastolic heart failure is due to impaired relaxation of the ventricle, and because of decreased relaxation in the diastolic phase, there is decreased filling of the ventricle, and this can cause heart failure. The causes are coronary ischemia causing scarring of the left ventricle, or hypertrophic cardiomyopathy where there is hypertrophy of the left ventricle, or restrictive cardiomyopathy in diseases such as amyloidosis or sarcoidosis. These disease conditions increase the stiffness of the left ventricle, thus decreasing the elasticity of the left ventricle, causing reduced relaxation. So this restricts the relaxation of the ventricle, and because of reduced relaxation, the filling phase is reduced. There is reduced filling of the ventricle because of increased ventricular filling pressure. So reduced filling in the ventricle during the diastolic phase can cause diastolic heart failure. To be kept in mind that in diastolic heart failure, the ejection fraction is preserved, unlike systolic dysfunction where the ejection fraction is reduced and the cardiac output is reduced. So in diastolic heart failure, the filling pressure is increased, the filling of the ventricle is reduced, but the ejection fraction is normal. So in a nutshell, what we have discussed about the types of heart failure, the first type of heart failure is low output versus high output heart failure. In high output heart failure, the contractility of the heart, cardiac output, stroke volume is increased, and therefore it is known as high output heart failure. In low output heart failure, there is weakening of the cardiac muscle, and this decreases the contractility, the stroke volume, cardiac output decreases, and this results in low output heart failure. The second type of heart failure is when the low output heart failure is divided into left ventricular and right ventricular heart failure. The left ventricular heart failure is the most commonest form of low output heart failure. The left ventricular heart failure is in turn divided into systolic heart failure and diastolic heart failure. In systolic heart failure, there is failure of the pumping action of the heart, which results in decreased cardiac output, reduced ejection fraction. Whereas in diastolic heart failure, the left ventricle is involved, but there is impairment in the filling of the ventricle, but the ejection fraction is preserved. This is also known as preserved ejection fraction. So there are three types of heart failure: low output versus high output heart failure. Second is left-sided versus right-sided heart failure. And third, systolic versus diastolic heart failure. Lastly, why is it important to identify the type of heart failure? The signs and symptoms, clinical tests and measurement of ejection fraction indicates the type of heart failure and helps in the diagnosis of heart failure. And based on the diagnosis, the treatment of heart failure can be initiated. Majority of the pharmacologic intervention is targeted towards low output systolic dysfunction. If you find this video useful, please like, share and subscribe. Thank you for watching.